Hello and welcome to my channel. In this video, we will discuss about homeopathic treatment for Tourette syndrome. So are you looking for a homeopathic treatment for Tourette syndrome? So let's talk about the homeopathic medicines which has been used for the treatment of Tourette syndrome. So before starting about the treatment, the homeopathic medicines, first of all, I would like to discuss about the meaning, that what exactly is the meaning of Tourette syndrome. So let's talk about it. So what is Tourette syndrome? So Tourette syndrome is a neurological disorder. It is a involuntary tics, which are repeated involuntary physical movements and vocal outbursts. The exact cause is idiopathic. Tourette syndrome is a tic syndrome, and the tics are involuntary muscle spasms. They consist of sudden, recurring twitches of a group of the muscles. And the most frequent form of the tics involve blinking, sniffing, grunting, throat clearing, grimacing, shoulder movements, and head movements. I hope the meaning of Tourette syndrome is clear to you guys. Now next, we'll talk about what are the symptoms of Tourette syndrome. So symptoms can vary from one person to another, and the symptoms include uncontrollable tics and spontaneous vocal outbursts. They usually first appear between the age of 4 and 6. And starting with small muscles, tics of the head and neck. Eventually, other tics may appear in the trunk, that is torso, or the limbs. And the people who are diagnosed with the Tourette syndrome often have both a motor tic and a vocal tic. Motor tic involve movements, while vocal tics involve sound and the speech. And the symptoms tend to worsen during periods of excitement, stress, and anxiety. And symptoms which are generally most severe during your early teen years are tics. Next, we will talk about what causes Tourette syndrome. So Tourette is a highly complex syndrome. It involves abnormalities in various parts of your brain and the electrical circuits that connect them. If you have Tourette syndrome, an abnormality may exist in your basal ganglia, the part of your brain that contributes to controlling motor movements. And the chemicals in your brain that transmit the nerves impulses may also be involved. These chemicals are also known as neurotransmitters, and they include dopamine, serotonin, and norepinephrine. Next we will talk about the investigations, that how is Tourette syndrome diagnosed. So your healthcare professional will ask you about your symptoms. The diagnosis requires both one motor and one vocal tic for at least 1 year. And some conditions can mimic Tourette syndrome, so your healthcare professional may order imaging studies, that is MRI scan, CT scan, are not required for making a diagnosis. These studies are ordered in order to rule out other conditions that can cause similar movements, such as brain tumor or temporal lobe seizures. So people with Tourette syndrome often have other conditions as well, like ADHD, that is attention deficit hyperactivity disorder, second obsessive compulsive disorder, anxiety disorder, moods disorders. The main part of this video, that is treatment. So now we will discuss about the homeopathic treatment for the Tourette syndrome. So first and the foremost medicine, as you can see here on the screen, is Agaricus muscaris for the Tourette syndrome with motor tics. So twitching and trembling are the main indicated features that indicate the use of Agaricus, a top remedy for motor tics. It is used in cases where there are marked motor tics like eye twitching, facial twitching, shaking of legs, jerking of the head, etc. The twitching typically stops during sleep. There is a trembling sensation in the lips and the lower jaw area. Twitching of the hands get better while doing manual work. The child tends to have quick and hurried movements of the upper limbs. There may be jerking motion of the legs. It is a homeopathic treatment for twitching and is recommended to cure tics in kids who are hyperactive and clumsy without any fear of danger. And the key indication for using agaricus muscaris in Tourette syndrome are: first, twitching and hurried movement; second, trembling of the lower jaw area; and thirdly, hyperactivity and clumsiness. Now let's talk about the second medicine for the Tourette syndrome, that is stramonium. So, for the Tourette syndrome with vocal tics, stramonium is a medicine used to treat frequent vocal tics, where the child tend to babble all the time, irrelevant at the endless talking, stammering, spasmodic dysphonia, that is hoarseness of the voice, and some symptoms that indicate the need of this medicine. Along with vocal tics, this medicine also works on the muscles used for locomotion. Motor tics like twitching of hands, clapping hands overhead, shutting and opening of hands all indicate the need of this medicine. Now the key indication for using stramonium are frequent vocal tics, hoarseness of the voice, use of hands indicated motor tics. Now third medicine for Tourette syndrome is hyoscyamus niger. So hyoscyamus is a medicine used, but it is not able, the child can think but is not able to answer questions appropriately. Muttering is absurd, muttering of the absurd things to a constant unintelligible chattering along with a desire to be naked are the main symptom indicated the need of this medicine. The child may also show irrelevant and frequent outbursts of the laughter. Key indication for using hyoscyamus are grimaces, unintelligible chattering, and nakedness. Now fourth medicine for Tourette syndrome is ginkgum metallicum. That is for the Tourette syndrome with fit getting. Ginkgum is a very excellent medicine that plays an essential role in the muscle control and coordination. Fit getting of the lower extremities, a restlessness of the legs, keeping feet in constant motion, jerking of the body, trembling of the hands while writing are the symptoms that indicate the need of ginkgum. Ginkgum metallicum is also used to treat echolia, where the child repeats everything said to him. It is also used to treat spasmodic twitching of the face, rolling of the head, and grinding of the teeth. So, the key indication for using ginkgum metallicum in Tourette syndrome are fit getting, grinding teeth, and echolia. Fifth medicine for Tourette syndrome is argentum nit, that is for the tics due to anxiety. Argentum nitricum is a medicine used to treat cases where the tics are typically worse when a person experiences anxiety. The medicine eases anxiousness and nervousness in the kids and is helpful in cases where there is a loss of voluntary control of the muscles and trembling of the body parts. Trembling of the hands that make writing difficult, trembling of the legs and balance issues, unsteady walking when unobserved, and impulsiveness in the children are some symptoms. An extreme desire for the sweets may also be present. So, the key indication for using argentum nit in the Tourette syndrome is tics worse during anxiety, trembling of the hands and the legs, and desire for the sweets. So these are the top 5 homeopathic medicines which has been used for the treatment of Tourette syndrome. Now next we'll talk about the supplements to use for the Tourette syndrome. So the first supplement, as you can see here on the screen, is magnesium. Let's talk about it. So magnesium as an element works well for the central nervous system and it improves the function of the muscular system. Low level of magnesium also makes an individual vulnerable to anxiety and depression. Both are common triggering factors for the tics. Therefore, a diet which is rich in magnesium can help manage Tourette syndrome. And a diet rich in omega fatty acids and vitamin B12 can also help control both motor and vocal tics in children. Now, food to avoid in Tourette syndrome. So, avoid food items one is allergic to can be of a great help. Avoiding dairy products, especially if there is a sensitivity towards milk and dairy products, can help reduce the recurrence of the tics. The protein casein found in the milk and the dairy product is found to be the main culprit for an increase in the occurrence of these tics. A casein-free diet can help control of the tics. Similarly, a gluten-free diet has also shown to reduce the motor tics and the behavior issues associated with the Tourette syndrome. Now, the lifestyle management for the Tourette syndrome. So let's talk about it. Exercise or indulging in relaxing activities like yoga and meditation, etc., can help soothe the child and reduce the intensity and the frequency of the tics. Environment and allergens plays an important role in triggering tics. They should be identified and avoided as far as possible. That's all in this video. We have discussed about Tourette syndrome and its treatment with homeopathic medicine. So that's all. That's all for today. See you guys in our next video. Till then, stay connected with us for more videos like this. Don't forget to subscribe and comment below, and yes, press the bell icon for more updates. Stay safe and stay healthy, and yes, thanks for watching this video.